So, ladies and gentlemen, dear colleagues, welcome to this press conference concerning living environments for the elderly. The Minister of Health and Social Services, Ms. Danielle McCann, and the Minister responsible for seniors and cares, Ms. Marguerite Blais, are together today with Dr. Quoc Dinh Nguyen, who is an internist-geriatrician specialist in populational epidemiology at the CHUM. So, ladies, hello everyone, hello again. So as your colleague said, I am together today with the Minister responsible for the elderly and cares, Ms. Marguerite Blais, and Dr. Quoc Dinh Nguyen, who's an internist-geriatrician specialized in populational epidemiology at the CHUM. And as you know, we have a situation that has worried us since the beginning of the crisis, the vulnerability of our elderly, and most particularly those who are housed in living environments. Talking here about CHSLDs, private elderly residences, and intermediary and family resources. Our priority mission is the protection of those people who live in those living environments and the staff who work there. Since the beginning of this crisis, we have invested $133 million to support the living environments of the private sector. We have taken measures that have made it that we have 450 extra doctors who are ready to support the people who already work in those living environments, either by phone, video, or on the premises. Specialists will also be contributing to that collective effort very soon. 500 nurses have re-registered with their order to come support our network. We also have used other professionals in our network, for example, physiotherapists who come and help out in our living environments. As I mentioned earlier on, we have increased screening in CHSLDs, which will be done at a rhythm that is proportional to our ability to screen, generally speaking, and we will prioritize places where there are outbreaks. We acted quickly to protect our elderly and our staff. It is now time to be more aggressive towards the virus that is being such a threat to our elderly. So we'll make no concession. We have to mobilize ourselves to ensure that these vulnerable people have the best possible safety, which means increasing support to the teams that take care of them, as well as those who ensure the prevention and control of infections in those environments. I wish to also salute all the staff that works every day with this clientele in these living environments. And I will now hand over the mic to my colleague, Marguerite, who will be announcing extra measures being taken to protect our elderly. Thank you. Thank you very much, Danielle, Dr. Nguyen. Ladies and gentlemen, hello to everyone. Faced with how serious this crisis is, we have decided to requisition the best experts in the domain. Our objective is to act even more strongly and more closely in the field. We will therefore be in measure to move immediately in an adapted way to each living environment. I am therefore very happy to be announcing that we'll be able to count on the expertise of Dr. Quoc Dinh Nguyen as an internist-geriatrician physician specialized in populational epidemiology in people getting older at the University Centre of Montreal Hospital, who will act as our special advisor to support us in our efforts and make them even more efficient to save lives. I will remain in constant contact with Dr. Nguyen. His phone number is already programmed in my cell, and believe me, I will abuse this, how often I will use this telephone number. So I'm happy to be able to count on him. On top of Dr. Nguyen, we can also count on 6 other specialists, clinicians, in this crucial operation to protect our elderly and our vulnerable people. All together, they are going to be able to do a follow-up in real time as far as the situation of COVID-19 is considered in all living environments for the elderly, and they will be able to recommend to us the best actions to set up as required. In other words, we will now go to actions as soon as we have a problem somewhere. These other specialists are Dr. David Lucier, geriatrician at the University Institute of Geriatrics at Montreal, and scientific, Dr. Patricia Ayoub, who is head of the General Medicine Department, as well as medical coordinator at the Support to Autonomy to the Elderly at the Maisonneuve-Rosemont Hospital, Dr. Serge Brazeau, who is the president of the Geriatrician Association of Quebec, Ms. Catherine Abar, nurse and expert advisor in geriatric care at the National Institute at the Ministry for Health and Social Services, Dr. Pierre Duplessis, specialist in public health and expert in crisis management, and Dr. Danielle McCann, official representative of general practitioners who work with the elderly in living environments and at home. No living environment is going to be left behind, whether it be housing centers or public or private, whether it be subsidized, private residences for the elderly, intermediary resources, or family-type resources. As my colleague mentioned a few moments ago, many measures have been adopted up until now, and these are going to contribute, and they contributed to saving lives. As we know, however, we have to do more because the pandemic affects living environments where our elderly live more strongly. We know this. These are unfortunately the people who are the most affected by complications due to the disease. It is in this group that we see the greatest loss and the highest death toll recorded up until now. That is why today we wish to double in our efforts to remedy this situation. I would like to remind everyone as well that we wish to protect the members of the staff of these living environments. We need the precious support of these guardian angels to be able to face this public health crisis, which is a major crisis. The best experts will be able to adjust and guide the actions that will protect our elderly, the most vulnerable people amongst us, as well as the staff who care for them. We still have a lot of challenges ahead of us, and it is all together that we will be able to face them, thanks to the respect of the guidelines and our collective determination. I'll now give the mic to Dr. Quoc Dinh Nguyen. I'm sorry. Who will talk to us about the new measures that will be deployed to protect our elderly? So, Madam Ministers and the elderly and all their loved ones, we know that these times are difficult for the elderly. This last week, I think that we all really felt shocked by the number of deaths in the living environments for the elderly, and it's even more the case for those who work with the elderly, such as myself. And I'm thinking about the geriatricians, the doctors, all the social workers, the occupational therapists, the respiratory therapists, and the people who recognize in these patients residents. Despite everything, up until now, we have no shame to have about the efforts that we've deployed. We have had a very good collective response facing this, and up until now, despite everything, we have managed to delay the progression of the pandemic in solidarity and to flatten certain curves and to reduce the number of cases hospitalized. But it would be false to think that we've won, because despite the fact that very early on, Quebec set up strong measures to avoid the contagion in residences and CHSLDs, there has been a spread despite everything. And this spread, if we don't do anything, will continue. So we have to readjust things. So as Ministers McCann and Blais have announced, I will act as a special advisor to them. I've already had the opportunity of speaking with them, and we already have statuted on a few actions that we'll be setting up, preliminary actions to protect our elderly who are housed in these living environments. As we speak, certain of these measures are already being set up, and I can make a summary of them to you. So first of all, the idea of reassigning existing human resources, reorganizing how care is given out, and increasing the teams. So that means to reassign doctors, nurses, and other healthcare staff of the hospital staff towards those centers. It also means recruiting and integrating people who have offered their candidacy up until now and done so very generously. And it means, of course, training and deploying the staff more quickly. We're thinking about reorganizing the work and the care procedures in order to decrease the number of contacts. We also wish to ban work on more than one unit or more than one establishment. And I think that we also need, secondly, to intensify the measures and the number of screenings of COVID with the users and the staff who work in CHSLDs, and I would also add in RPAs, the residences for the elderly. And I think that we have to isolate those people more efficiently. Thirdly, we have to cease until further notice the transfer of new users in these centers who don't have the ability of isolating them 100%. We have to offer protective measures to all the employees who work with the elderly, including private residences for the elderly, or RPAs. And finally, we have to set up, and this is already ongoing, a team of experts in epidemiology to be able to have targeted investigations in order to be able to increase support to training in control of infections. These are the beginnings of a series of measures. As a Quebecer, I really believe that we've proved our capacity to set up a strong and unified response facing this pandemic. But it is when things get more difficult, and honestly they are getting more difficult, that we can really show what our strengths are. We have to be able to do more, and I think that we still have a lot of tools to be able to use. The measures that we're set in will only succeed if we adjust ourselves quickly and if we are inventive and flexible collectively. And I think it's important to mention that we have to be patient, because even though this virus spreads very quickly, it does hurt very slowly. So each thing that we do well will need a few days to show that they were good, and the next few days may be very difficult. Regardless, I hope that in the weeks and months to come, our Quebec pride, honestly, will be drawn in our ability to be able to say, here we are, to our elderly, to make sure that things are going well for all the elderly, their families, their loved ones. Let's make it that it goes well for all of us. Thank you, ladies, ministers. Mr. Nguyen, we will start now the question period in French. Hello, Dr. Nguyen. You've made a list of the actions that have been set up, and I would like to hear you. What could have we done better or done more ahead of time to avoid the crisis in front of which we are faced? 2 points, perhaps. The first is to say that the idea of creating a group of experts is to be able to supply and to continue creating measures that are efficient with the new data that we're getting. The second point is, despite everything in this pandemic, the great difficulty that we had, and we're not the only ones, is that we had never faced it before. Even if we look in the best countries, and we often talk about Germany, they themselves don't necessarily have the one magic solution for the residences for the elderly and for CHSLD. So the idea is to create a group to be able to work quickly and to be able to set up those measures. I would give you an example. All these measures are at a good step, but the idea is to be able to implement them quickly with the collaboration and the work of the people in the field. I would add something, if you'll allow. It is also to be able to follow in real time the evolution of COVID-19 and to be able to act immediately, so to emit recommendations to the ministers so that we are able to immediately set up what is required as far as actions are concerned. I think that that is what will make it that it will be in real time. It's the real time that will bring an important change when we look at what is going on. Complementarily, if you'll allow me, you said a few moments that the next few days could be very difficult. What do you mean by that, Dr. Nguyen? That's a good question. This disease is an infectious disease. It's spreading. Since the beginning, we're talking a lot about the number of cases, hospitalized cases, intensive care. cases, as of the time that somebody gets the disease, there's a number of days before that person deteriorates, and consults somebody, and a few more days for the people who have a more serious part that they develop it. So from the time that you contract the disease and that you die of it, for the people who are unlucky, there was many days that go by. All the measures that we're setting up that wish to reduce the transmission of the disease are going to reduce the transmission as of the moment that we apply them. But on the number of mortalities, it'll take many days to be able to be shown. It's like almost exactly a month ago we had announced measures, we had thought of measures, but it took us a month before the curve showed us, or 3 weeks. But it's that same idea with the deaths, and that's why I was mentioning that. All right, so next question. Hello, ladies. Hello, sir. I don't know who the question is for, but I'll ask it anyway. There are 6 CHSLDs in Quebec where the situation is critical right now. That means that there's hundreds of others have managed to contain the spread of this disease within their walls. What makes it that there was such a difference in the management of COVID-19 in those centers for elderly? Is it a lack of goodwill, a lack of information, a lack of tools or training? What explains, according to you, that in certain places it went very badly, and in others, it seems to be under control? I will perhaps let Dr. Nguyen answer that, because he has an epidemiological point of view on that. But what I would like to say about the management is that the guidelines were the same for everyone. All the measures that we took were the same for everyone, and the managers were supposed to comply with them. But of course, as Dr. Nguyen said, we've never faced a pandemic before, and these measures were set up as quickly as possible. Potentially, there was, of course, Dr. Arruda talks about it often, there was the spring break. There were perhaps in certain residences certain contacts that were more frequent, or a transmission, but I think that it is more from an epidemiological point of view that Dr. Nguyen could answer. One of the recommendations is to elaborate epidemiology teams that will go and try to understand how the virus came in and how it spread. That, I think, will have the result of these investigations, and then we'll be able to give you a more complete answer. Spontaneously, it is places where there probably were travelers who came back after March break, because, these are populations that are probably more multi-ethnic who travel. I also think, and this is an extremely important point, and it shows the difficulty and the problem that we are facing, living environments for the elderly are very heterogeneous. What I mean is they're very different. Some have a lot of good material, very connected on networks. Others are not so much so. And the challenge right now is that the elderly are everywhere. So we have to try to mobilize a network and bring people in the field as much as possible to try to flatten that heterogeneity and the differences in all of them. I would like to say that it was very difficult also to understand the virus as such. It's invisible, and I think that at the beginning, when we said it, at the 14th of March, that people were going to be confined in the residences, or people who didn't believe it. It was very difficult. That confinement was difficult because the virus, being invisible, we don't know that we could be a vector, because we don't feel any symptoms. And then finally you develop the disease, but you can also transmit it. And I think that that is what's snowballed. And if I could add a small precision as well, we're talking about a certain number of CHSLDs where there's more cases, but you have to understand that this is a disease that is declared, as I mentioned it, more, it has a delayed reaction. So a possibility that we wish is that it stays only in one CHSLD, but the other possibility, such as Montreal, which is an advance compared to other parts of Quebec, well, perhaps these are perhaps a little bit ahead of time, face one compared to the others. And that's why we're trying to act so quickly to try to slow any spread into areas where they're not strongly affected yet. And where we can see as well, many of these places where there are outbreaks are in the greater Montreal region. So where there was transmission, where the curve is going more quickly in Montreal, more quickly than other areas in Quebec. So we want to take preventive measures in all CHSLDs and living environments in Quebec. Ms. Blais, we know you. If you could, you would personally take care of each and every elderly person in Quebec. But some are going through very difficult situations right now. Has the system abandoned a part of Quebec's elderly? Absolutely not. Absolutely not. Listen, every day I have meetings with the Minister for Health and Social Services, with Danielle McCann. We are working so hard. And as we said at the beginning, it's like that pretty much in every single country. And we took the right measures when we decided to free up beds at hospitals, because for the elderly, a place in a hospital when they are cured, they shouldn't be there. They should go back to their living environment, and that is what we did. Never will we abandon our elderly. It's been about 2 or 3 days that the Premier keeps on repeating it. We have to care for our elderly, and I think that we are caring for our elderly, and very probably, actually I don't even say far probably, yes, it will happen. With what we are doing, with our expert here and the other experts, we are able to follow the evolution in real time and set up the measures that are necessary that will bring about a great change. And we'll be able to see changes within 3 weeks. Is that correct, Dr. Nguyen? It depends on the measures we'll be taking. But we will be seeing changes. And Danielle McCann said so. We heard Dr. Francard said so, who mentioned that there were 450 doctors, specialists, family doctors who are available. There's more staff. We added 1,000 people. There are people who are coming to help out, and that will make a great difference. There's also the reorganization of the working environment. Dr. Nguyen talked about it as well. We must reorganize the work environment to decrease the number of people who give care to one resident, so that it be always the same people, that they don't go from one building to another, from one unit to another. We are reorganizing all that, and that requires more staff. And that is why we are redeploying people in order to add staff in those living environments. This change of culture is not done so easily. We're asking people in the healthcare system to change the organization as quickly as possible. Next question. A question from Ms. McCann. And I understand that the question was asked a little bit earlier today, but I think that the situation has evolved. Are there guardianships being considered for certain CHSLDs? I will tell you that there are 2 CHSLDs, private ones, or one is a CHSLD, and the other one is a residence for the elderly, where the establishment of the region did take over the site. There's one in the west side of the island, the CHSLD called Héron, and the other is the residence for elderly called Liverpool in Lévis. These are establishments that are private, and unfortunately in these establishments there was contagion, and the staff was also affected. There wasn't enough staff to continue caring for the residents. So the establishments, Ouest-de-l'Île and Chaudière-Appalaches, took charge of those establishments. So they ensure the services in those places right now. I want to understand, is that being imposed or requested? Well, it was asked, certainly by these 2 establishments. It's not simple. On the Chaudière-Appalaches side, it's going, but on the Ouest-de-l'Île, there are things to be discussed. We are taking charge of it at any rate. But what does that involve? What do you mean by it's not simple? Well, it's not simple because, of course, this is a private establishment, and it's already known by the CIS or the CIUS, but we have to find the staff, and thank goodness we found it. We have to stabilize the situation. I must say that it was done in both cases. And of course, these are private establishments. Therefore, we have to see from a formal point of view how it will be continued. Is it going to be guardianship or not? We are examining the entire situation. But clinically speaking and talking about the care of the people, that is stabilized. So people have been taken charge of. But a good thing that took place as well is that despite the fact that it is private, the CIUS of Ouest-de-l'Île of Montreal concerning the Heron residence took responsibility of going to care for the elderly. And that is a good thing. It's the same thing that took place as well at the Chaudière-Appalaches CIUS, to go on the premises and take responsibility together with the team. Ms. Blais, my question is for you. I would like to hear you. How would you qualify the present situation? You know, we hear testimonies every day. People even, talk to you directly, and you say, never will we abandon our elderly. But you've heard some testimonies from families who right now feel that they have been abandoned, feel that they are abandoning their loved ones within those walls of the residences for the elderly in CHSLDs as well. How would you qualify the situation right now, Ms. Blais? I would tell you, as a minister responsible for the elderly and for people who care for others, it's a very difficult decision. It was a heartbreaking decision to ask families to not come and visit the family members that are housed in those places. One day, those people will be able to go back to their loved ones. But it is difficult. I am very conscious of the fact that these caregivers are suffering a lot right now. That is the reason why we took the measures. And all establishments, all the CIUS and the CIUS had until the 1st of April to transmit to us the technology that they were going to be using to be able to communicate with their loved ones, and also identify staff who would be able to communicate with the families. We absolutely must do that everywhere. Families have to receive information about their mother or father, the person who is being housed, because otherwise it's unsustainable. So those guidelines, Ms. McCann and myself, we absolutely make sure that it is respected everywhere with that information. Otherwise, it really is untenable. And even we're receiving on the part of different groups iPads that will be sent to all CHSLD, so we'll be able to try to communicate as much as possible. That communication is important. My question is also to Minister Blais. Many people have mentioned to me, recently you were at Tout le monde en parle, you said, yes, I'm in voluntary quarantine, I'm making an obsession today. You came to Quebec, you're a doctor with a doctor from the CHUM. Does that not contradict the guidelines of public health, especially since today Dr. Arruda was seated in the same spot as you, was saying, well, it's been now a month that I haven't gone back to Montreal, that I don't see my spouse. What would you like to answer to that? This was an exceptional situation. Listen, we are coming to announce. We had an expert advisor. We are coming to announce that we've been in contact with Dr. Nguyen, and we set up new measures, and that we went to get the best experts. It seems to me that I have to be here today beside Mr. Nguyen and Ms. McCann to be able to tell the population of Quebec, we are taking this very seriously. I do have the title of Minister responsible for the elderly, so I have to take that spot when it's time to. And today, it was exceptional to come here at the National Assembly to talk to the population and to tell the elderly, we are taking care of you, and to take caregivers, we're not going to abandon you. So that's what it is. And if I may, if I had not moved, I think that we could have had the question, oh, but why is it being video conference? Why is it not a priority? So, well, now that it's said, I would like to take advantage of your presence, Ms. Minister Blais, to give you the opportunity to send a message to the elderly who are at home right now and who over the weekend are sad because they won't be able to see their grandchildren, and to whom the Premier announced yesterday that for them, the confinement will last months. What is the message that you have for them today? Well, listen, the Premier mentioned that he was going to phone his mother. Well, I have many children, and I have 11 grandchildren. And they are my reason to live right now. And not being able to see them is very difficult for me too. Because, Christmas and Easter are holidays that are moments to spend in family and to be happy together. But we're going to do FaceTime and we'll communicate in this way. But it is really important because we are reducing the curve. And if we're not careful, Dr. Arruda was saying so, we could embark on a second wave. And I'm telling you, keep hope. Speak with your parents. Speak with your grandparents. Find other ways of communicating. But please, stay home. Those are the guidelines. Stay home. Have 2 meters between you and anybody else. Wash your hands, cough in your elbow, and don't go shopping too much because there's still elderly, unfortunately, who go shopping too much. So have things delivered to you. There's volunteers, there's neighbors. Please respect the guidelines. I beg you. As a group that thinks specifically about the elderly, I can tell you that it's certainly a priority for us. I unfortunately cannot say that is the #1 priority because the #1 priority is to decrease the spread of cases in CHSLDs and RPAs and to give tools to the people working in those fields. That will be really our warhorse in the next few days. But, of course, there are international predictions of how we do to deconfine people. How do we do it properly? Do we have to do it per age group or not? People from public health, of course, are talking and thinking about all that, but our idea is to bring the elderly lens. We have no idea when we're going to get the answer, but the faster we flatten the curve in CHSLDs and in elderly housing, the earlier we can start talking about visits. So that will be the priority. So when Dr. Nguyen talks about curve, because of course when we talk about real time, it's a curve. The curve in CHSLDs and the RPAs and intermediary resources and family type resources. And that curve will be able to follow it in real time, and that is what we want to decrease as well in the elderly living environments. Ladies, sir, Ms. McCann, do you admit having underestimated the impact of coronavirus on CHSLDs? Well, I will tell you, I think that as Dr. Nguyen just said, a pandemic is something new. It's something that all countries are stuck with. It's a new virus. We did not know it. And I believe that the measures that we took, those are the measures that we had to take. And of course, we are now getting to another stage, and that is why we are taking other measures and we are adding to the measures, and we will get there. As my colleague said, we want to flatten the curve of the CHSLDs and the residences for the elderly, the RIs and RTF. So we want to care for our elderly particularly flatten that curve. So we'll continue our actions and even intensify them and take all the measures concretely. As Dr. Nguyen said, we have to implement them. So we are bringing together all the conditions, the staff, to be able to do that. I understand, but at the beginning you put a lot of emphasis on freeing up beds in hospital centers. You put a lot of staff. You announced that there were people who were in hospital centers that you were transferring doctors and nurses towards the CHSLDs. There's 119 deaths in CHSLDs out of the 241, so that's half of the people who have died of COVID-19 were in CHSLDs. My question: did you underestimate the impact of COVID-19 in CHSLDs, taking into account the numbers, statistics, and what I just mentioned, the staff that was not in the right place, etc.? Well, I will say one thing. We absolutely had to free up the activities that we did in hospitals. It was only a month ago. But we had to plan, and we might have had a situation such as in Italy, where we might have needed 6,000 beds. Hold on, I am answering. We knew, however, the elderly would be the most affected. That is why we took measures. But we had a hard time because, amongst other things, as we often say, the March break, the spring break, where there were travelers, and we didn't know it at the time. We didn't know the situation as we know it now, and who, unfortunately, there was propagation in different ways, and that was very difficult. And I believe that in other provinces, because I also do speak to my colleagues on that, where the spring break, where it came later, it helped them out. They learned from Quebec because we put our measures earlier than they did. So I believe that unfortunately, with the spring break, there were people, children, who went back into CHSLDs because we did not have the knowledge of the situation that we had just even a few days later, where we set up the measures quickly, and we unfortunately had spreads in CHSLDs.
Pour compléter, en français, une question qui nous provient par courriel de Marco Bellaire-Cirino du journal Le Devoir. Two
CHSLDs, private ones from the Montérégie, say that they simply have no protective equipment left, and that the Montérégie Centre refuses to deliver them, which could force the staff to care for people without masks. Are you aware of that situation, and what can be done in such a case? Can we force, for example, them to send material? It's already been done. We've already dealt with that. You know, that the communication in a situation such as this one is very important. And the speed, the logistics, so we already sent the material. They have everything that they need, and that is why it's important. As I was saying, the establishment is also responsible, not only for the public, but the entire private sector as far as housing is concerned, and that problem has been fixed. We have the private establishment, which has everything that it needs, and we invite everybody to tell us about their needs quickly so that we can really deal with them. More broadly, the CIS or the CIUS, do they have guidelines saying that they first have to respond to the demands in public CHSLDs before the private ones? No, we answer all requests. People who are housed in the public sector, in the private sector. We have to answer to all those needs, and it is done, and it will be done with the residences for autonomous, elderly, the RI, and all other ones in the private sector. English now.
Good afternoon. The spotlight for days now has been on CHSLDs and nightmares that families are going through. For example, Sainte-Dorothée. I would like to know, because I have the feeling that you're justifying what you're doing. You're putting forward like a committee of experts to explain that you haven't failed to protect seniors in Quebec, even though there are many stories saying the opposite. What will you make you be satisfied with the measures you're putting in place to say we finally were able to protect some of them?
We want to save life. It's a simple question. We want to save lives. So to be able to save life, sometimes we have to adjust what we are doing. And we are adjusting what we are doing at this moment with people like specialists who are working every day with senior citizens who are living in CHSLD or private residence for seniors, and we are asking them, we are asking especially to Dr. Nguyen to be our guide. So we will be in time, just in time, every day. I will speak with him morning, night. I'm going to call him at the middle of the night if I have to do it, to make sure we can act immediately to be able to save life.
What I could add, I think the most important metric we need to follow is to, one, ascertain that the cases that occur, we know that they are occurring and we're not missing any. That's step number one. Because cases we know about quicker than hospitalizations or death. That's number one. And if that can be achieved quickly, then the most important number will be cases in CHSLD, RI, RPA. Then, of course, and if we can't get the number of cases quickly, then of course the other metrics can also be used, such as number of cases that go to the hospital, But the best would be cases, and that's the best single metric. After cases, of course, I think it's people on the ground, right? People who see it. I think there needs to be a mechanism so that we get the feedback quicker than I think what we've been able to get up to now, if that's possible, so that we can know that everything that we talk about here as experts gets down to the ground. Again, it's going to take a bit of time, right? Nothing's going to change instantly because this is not a disease that changes instantly. The tendencies are there, and I'll stay the same way for a few days at least.
Second question. You talked about the CHSLD of Heron in Dorval. So that's one of the CHSLD private, one of the facilities private that asked to be taken care of. Like, it's not a trusteeship.
No, but we're taking charge of the services. It's going to take a certain form, but it's not a trusteeship at this point.
Do you know the number of deaths, the confirmed cases and suspected cases at the CHSLD Heron?
I know that there have been 2 deaths due to COVID-19 in the past month, and 18 deaths that are not linked to COVID-19, that are not diagnosed with COVID-19. And that's the information I have at this point. Yeah.
Cases or
suspected, I don't have the number at this point.
Thank you. Okay, so a question now sent by email from Phil Autier, Montreal Gazette. Did you know that at the residence Heron in Dorval, public health officials found dead bodies and residents covered in their own faces? What is your reaction to this?
Well, I was just informed just before I came to the press conference about what you just mentioned. And the CIUS took charge of this residence a few days ago. So this information I just learned today. So I want to have a report on this. And of course, this is very preoccupying. But I do trust that the CIUS has taken charge and is taking care of the people inside the residence. I want to reassure the families about this particular finding 2 people that were dead. I have to make a lot of verification on this, and I'll do it quickly.
Second question for Mr. Autier. Why didn't the government inform family members of residents and the public on how bad the situation was at Résidence Heron, and what led it to being under some kind of trusteeship?
Well, I don't know what the previous administration did with the families, but I can assure you that the CIUS is informing the families because we have given the directive to the whole network of the residents in Quebec that the priority is to inform the families. So I've got a report just before I came in the press conference, and everybody has a priority to inform the families. This is absolutely basic, and we'll also have tools, as my colleague mentioned. We're going to increase that communication, but everybody has to inform, and the Résidence Heron is informing, the CIUS is informing the families about the situation of their dear ones.
Thank you. And now a question from Raquel Fletcher, Global News, again regarding the Résidence Heron. Will you launch an investigation, an inquiry into other seniors' homes to make sure these kind of atrocities aren't happening elsewhere?
Yes, we're going to be... there's going to be an investigation at Heron by the CIUS, but we will also reiterate, say it again to our PDG, that they have to be ultra careful about all the residents on their territory, and to really maintain sustained contact with them. We have teams that are doing that, and to be very vigilant about situations in the private homes, the small or different sizes private homes on their territory.
And now as a second and very last question for Raquel. As this crisis revealed that we have collectively neglected the care of our elderly. How will things change in CHSLDs and residents after COVID-19?
I think there's going to be lessons learned in the sense that we're facing a new virus. So we have to take extra measures, and that's why our experts are going to help us with this. And I think, and I was discussing this before, I think what we're going to do, and what we have done actually, and what we're doing now, and what we'll do in the near future, we will probably retain a lot of it in the future. When we say, for instance, that we should have teams that are devoted to particular units, and that people should not go from one building to another to give care, I think that's something we will want to keep for the future.
I'd like to say something. You see, when we were talking about les maisons des aînés, it takes all its sense because it's one individual by room, and one restroom for a room, and 12 units. So it's small unit. And in this way, it's going to be easier to be able to take care of the people who are living in these milieux de vie. With the other that we will transform, we have to transform them in the same way to make sure we don't have, everybody all together. Because when they are spread a little bit, it's easier if we have another type of virus. And also the way we're taking care of the people will change also. That's for sure. It's going to change totally.
So, thank you.
CHSLD et rond pour qu'on comprenne bien la situation.
So that we understand the situation well, because you said a little earlier on, I think, is it at their request, and what is the exact portrait of what is happening at the CHSLD? Yes, it was at their request because, unfortunately, many workers were affected by COVID-19. So there weren't enough people to care for the residents. So the Ouest de l'Île CIUS took charge of the residents and is giving services now with its own staff. I must say that they just told me about it, of an article that appeared and that relates. The CIUS took charge of that residence a few days ago, so with that information that I just learned, I have to make verifications quickly. This is not information that I had. I must make verifications on that, but I have to reassure you that the CIUS Ouest de l'Île is taking good charge and is giving the services to people, and I want to reassure the families that the services are given. Thank you. So I thank you to all three. Happy Easter.